Then we have a question from Avinash, which is maybe for you, Vincent. You touched upon data and privacy. Can you elaborate more on what exactly is done to ensure a user's data is owned by the user and used responsibly by companies? And how is this different from what it all used to be in the past?
Yes, sure. The Andaman solution has been designed from the start to be on those two principles that the GDPR made very famous. It's privacy by default and security by design. So everything in Andaman has been built around these two principles. Now, the data that the user enters or collects is always comes with a trace of the data. So we know exactly what data, who has entered the data and when it was entered. No data can ever be modified or removed. There is a very strong traceability mechanism in Andaman7 for that. And since the data is collected by the patient, automatically the system is very well aligned with all the privacy laws, right? Because all privacy laws apply mainly to people or companies using data from a given patient or citizen. In our case, the patient or the citizen is the one centralizing the data, collecting the data. He's the hub of the system, and he decides if he wants to share the data. There's two ways to share data, either by a decision that the patient is making, like, for example, I'm sharing the data of my children health record with my wife. I decide to share it. I push the data to my wife's phone. And the second way is to be invited, typically by a CRO or a pharma or medical research actor or a hospital. And there they are asking permission or from me to get a copy of my data. And I will see very clearly on the Andaman screen what data I'm sharing with the entity, the researcher. Now, regarding the use that will be done with that, of course, there's always a very strict constraint with that. You know that GDPR and upcoming laws in the US always say that you have to clearly specify what type of data is shared and for what purpose, right? If you want to use the same data for another purpose, you cannot do that. You have to ask for a new consent. So Andaman has been built to be able to provide those consent and those recurring consent or dynamic consent if you want, and to remove the consent if you don't want to share the data anymore. Now, will the companies use that responsibly? Well, there is a contract, an electronic contract between the company and the patient. So even if there's technical ways to go around that, the companies are under contract with the patient. So that's how it should be controlled.